Good morning. Good morning. My name is Crystal and I'm from William Carey. The doctor's ordered for us to check your sugar before you have your morning breakfast. Is that okay with you? Yes. Do you have any questions before I begin? No. May I check your ID band? Yes. Can you verify your name and your birthday?
Leslie McMillan, 10/9/1984.
Okay, that's correct. And do you have any allergies to anything?
I don't.
No. I've gathered all of my supplies, washed my hands. I would don clean gloves, set up my glucometer with the test strip, so that's prepared for when I need to use it. I also have a lancet, clean gauze, and an alcohol prep. Do you have a preference on which finger I use?
No, just the same.
Okay. So I would use the side of her finger. Oh, your hands are cold.
Yes.
Warm them up. They say cold hands, warm heart, right?
So my grandma used to tell me.
I could have her warm her hands under water, or like I did, rub, so that we can get circulation down to her finger to get a better stick. I would clean using the alcohol. You're going to feel a little stick. I would dispose of that in the sharps container. Get a little blood to come out. You wipe the first one off because it could have some alcohol left in it and skew the results. Put it into the test strip. Hold the gauze on. Your reading is 200 this morning. I know you've been living with type 1 diabetes for a while. So the doctor has a sliding scale of insulin. I'll go and check the MAR and draw up your insulin before we give you breakfast.
Okay.
Looks like it stopped bleeding. Can I get you anything before I go? No?
Thank you.
Okay. The doctor has ordered insulin. We have NPH and regular. I would check the MAR 3 times against the medication to verify that it was the correct order. And wash my hands, don some clean gloves. I would use an alcohol prep to clean the vials. The order is for 10 units of regular and 12 of NPH. I would begin by injecting 12 units of air into the NPH, making sure not to touch the insulin. And now 10 units of air into the regular. Withdraw the medication. And now going to 22 for the total dose. I have to be sure to get exactly 22. If not, I would have to dispose of the needle and start over. And since I am preparing the medication in a different area than where I will be administering it, I'm going to use the one-handed scoop technique to recap the needle. I've washed my hands, drawn up the medication. I would don clean gloves and check the medication against the MAR one last time for a total of 3 with the patient in the room. Verify her identification using the band and the MAR. Check to make sure if she has any allergies. With the medication, I have to check the 5 rights, which include the correct patient, the correct medication, both of regular and NPH, correct dosage, route, subcutaneous, and time, which is now, before breakfast. So I have the medication drawn up. It is 22 units of the total, so 10 of R and 12 of NPH. I would verify with the patient and with the medical record to see where her last dose was given. We don't want to repeat dosages in the same spot. So we're going to be giving it in the right lower quadrant. I would clean the skin with an alcohol prep, prepare the needle, pinch a little bit of the skin, insert it into the abdomen. I am not required to aspirate with insulin. Dispose of this in the sharps container. Apply pressure if needed with gauze. Alright, I have your breakfast tray. Are you in the position of comfort?
Yes, ma'am.
Any pain?
Nope.
No bathroom that you need to use? And do you have everything you need?
I do, thank you.
I can also bring you your coffee that you asked for.
Oh, thank you so much.
You're welcome.